Hi, I'm Brenda Power Ahmad, and you are watching OTV, where we provide solutions for living. In this episode of OTV, I'm going to talk about returning to work after an illness or injury. A well-designed plan to support an individual returning to work is vital to ensure a smooth and successful transition to both the employee and the employer. This episode will fill you in on how occupational therapists can help to support this critical transition back to the workplace following an interruption of work duties due to physical or mental health issues. In 2011, Statistics Canada reported that 5.9% of full-time employees were absent from work due to illness or disability. The costs associated with workplace injuries are vast. These include direct medical costs to the company, a decrease in company productivity or product quality, an increased level of stress placed on other workers, the loss of time created from finding a replacement worker and training someone new, and the often incalculable cost that comes from losing a skilled and valued employee. Research has shown that the duration of work disability as well as costs are significantly reduced when the workplace has contact with a healthcare provider coordinating return-to-work interventions. In fact, well-designed return-to-work programs are now recognized as the best practice to reduce costs associated with workers' compensation. When an employee participates in a return-to-work program, they are twice as likely to resume their job, and the number of lost workdays is decreased by 50% per injury. So, what can occupational therapists do? Occupational therapists work closely with employers, healthcare professionals, and workers to create a progressive return-to-work plan. Occupational therapists can facilitate communication between all relevant stakeholders, including the worker, the employer, medical and rehab teams, and the insurer. Coordinate appropriate referrals and recommendations for equipment and aids as appropriate. Analyze the job duties the individual is required to perform, including the physical, cognitive, emotional, and mental aspects. Analyze the environment, including the social and physical, and analyze the client's current facilitators and barriers to returning to work in order to identify strategies to modify or adapt duties as needed. Communicate frequently with employers to monitor the adaptation of duties and readjust demands as the worker's abilities change. Develop work hardening programs to develop or retrain the necessary physical skills required for job performance. Provide direct interventions to target self-management strategies, cognitive strategies, pain management, stress reduction, life skills, and mental health issues. Educate workplace parties on their responsibilities involving the Return to Work Plan under the Human Rights Act, the importance of return to work plans, and evidence that supports return to work plans. Occupational therapists also provide education on their important role in providing social and emotional support during the return to work transition, the benefits of the proposed modifications, and steps to minimize any negative impact, injury prevention, and health and safety through workshops, presentations, and training. Monitor strategies, supervise implementation, problem solve, and modify or adapt the program as needed to ensure a positive process for all involved. Overall, occupational therapy is a cost-effective strategy to accelerate an employee's recovery and rate of returning to work. With an effective return-to-work plan coordinated by an occupational therapist, injured or ill employees can recover and return to work more quickly, significantly reducing employer costs associated with an absent worker. In the end, remember that each person, each disability, and each environment often needs a unique solution to any given problem. Seek the services of an occupational therapist if you have a functional problem to solve. That concludes this episode of OTV. Remember, OT's know stuff.